Hi everyone, I am Dr Sanchaita Kohli, an oral and maxillofacial surgeon from New Delhi, and today we are going to talk about a very popular procedure called cleft chin correction or chin dimple correction. So what is a cleft chin? A cleft chin is a very common condition which is characterized by a defect or a dimple in the middle of the chin tissue. This defect can range in size from a small point in the center of the chin to the entire length of the midline of the chin. Now, why do some people have a cleft chin? So the soft tissue of the chin is formed by the fusion of two muscle bellies on either side of the chin called the mentalis muscles, which overlap in the middle. The clefting occurs in some people because of the incomplete fusion of these two muscle bellies in the midline. So these two muscle bellies on each side of the midline cause two bulges separated by a defect or a dimple in the center. This does not cause any functional problem but is a common aesthetic concern for some people. Different cultures have different notions about having a cleft chin and its association with one's aesthetics and one's personality. Many people think that having a cleft chin or a chin dimple is an aesthetic advantage, but most people want its removal or correction. So what is the procedure to correct a cleft chin? A cleft chin can be corrected with a very small surgical procedure. In fact, we can summarize this procedure as a 5S surgery. Safe, short, simple, straightforward and scarless. The surgery is performed under local anesthesia where the tissues over the chin are numbed. An incision is then given inside the mouth and both the muscle bellies are stitched together using a few absorbable stitches. This is a small and simple, low-risk 10 to 15 minute procedure which causes minimal facial swelling and the results are apparent within the same week. For overall improvement of facial aesthetics, this surgery may be combined with other facial procedures like buccal fat removal and chin augmentation. So what is the recovery like after a cleft chin correction? Cleft chin correction has a minimal recovery time. It is performed as an outpatient procedure where the patient can go back home the same day after their surgery. There may be some swelling and bruising over the chin area for up to 7 to 10 days after the surgery, but most daily functions can resume from the next day onwards. The only precautions required are a soft diet for only 24 hours after the surgery and maintaining good oral hygiene for good wound healing. The results for cleft chin correction are permanent and visible almost immediately after the surgery. Thank you for listening to this video.